Breast reconstruction is one of the most common things that I do. So this involves working with the breast cancer surgeon who initially diagnoses the patient with breast cancer and then develops a treatment plan or algorithm for the patient. So treatment options for patients that are seeking breast reconstruction include whether we're going to proceed with implant-based reconstruction or tissue-based reconstruction. And that is also tailored according to the patient characteristics, sometimes related to their physical and medical condition. And again, we choose what's right for the patient in this case. In some cases, with certain patients and certain breast sizes, we can save the rest of the breast and do what's called oncoplastic reconstruction. And what that simply means is we rearrange the rest of the breast to reposition the tissue and then reform a slightly smaller but well-shaped breast so that looking at it externally, it looks like the patient just maybe had a breast reduction or a breast lift. Other options include putting either an implant or tissue expander at the time of mastectomy. So if the tumor is large enough, or if there are other characteristics of the tumor or the patient that the breast surgeon is removing the entire breast, then we need to think about reconstructing the entire breast with an implant or a tissue expander. On the day of surgery, things that the patient can expect is we will meet them in the preoperative area, both the breast surgeon and myself, and then we'll start making some markings to locate, all the different landmarks that we need to identify during surgery. Then we go into surgery, and depending on whether we're doing a unilateral or one-sided case, or we're doing both sides, and depending on what type of reconstruction we are doing, it can take anywhere from an hour and a half, 2 hours upwards, depending on what procedure we're doing. After they go home, the recovery is usually, anywhere from 3 to 4 weeks of, taking it easy, and no strenuous activity, no heavy exercise or heavy lifting, and then we gradually get them back into their routines. So breast reconstruction surgery is one of the most rewarding things for both the patient and frankly for the surgeon. Nothing makes us happier than seeing a happy patient at the end of their struggle or challenge with breast cancer, which can be one of the most stressful parts of their life. Our goal in the end is to produce a result that is cosmetically pleasing to the patient and is as close as possible to what they started with.